For over 28 years in Malaysia, HIV has affected over 100,000 lives and continues to infect 3,000 people on average every year. Malaysian AIDS Council and its fundraising arm, the Malaysian AIDS Foundation, were established to coordinate, lead, and mobilize the community-based response to HIV and AIDS, guided by the Ministry of Health's National Strategic Plan on HIV and AIDS and the United Nations Millennium Development Goals. In the past 10 years, significant progress in the national AIDS response has been made, most notably the introduction of the Harm Reduction Program, which, as a result, has reduced new HIV infections among injecting drug users by 50%. Despite our successes, formidable challenges remain. Legal and structural barriers, stigma and discrimination continue to limit access to life-saving HIV healthcare services for key affected populations. The Millennium Development Goals expire in 2015. The situation is urgent. More so than ever, HIV advocacy is needed to address the challenges, sustain the national AIDS response, and create an enabling environment. In 2013, a partnership between Yayasan Sime Darby and the Malaysian AIDS Council was formed in response to this urgency. Yayasan Sime Darby, the main philanthropic arm of Sime Darby Berhad, is deeply committed to funding impactful development programs under its community and health pillar. The partnership began with a 3-year grant worth 870,000 ringgit to support Malaysian AIDS Council's HIV's leadership and advocacy program, which encompasses the following key areas: harm reduction and HIV treatment policy development, improving HIV workplace policy, advancing HIV and Islam programming, resource mobilization, stigma reduction, Red Ribbon Youth Club. The partnership also marked the first time that a corporate body had stepped in to sponsor Malaysian AIDS Council's secretariat expenses. Within the first year of grant implementation, further milestones have been achieved in the area of HIV treatment and harm reduction policy development, especially in the expansion of the Prison Reintegration Project, or TAMAN, to help incarcerated people living with HIV access health and welfare services upon release. The corporate sector's response to HIV has been particularly encouraging owing to the advocacy efforts of Malaysian AIDS Council. Most notable was the adoption of a comprehensive HIV workplace policy by Petronas Group of Companies, which looks to set the standard for future HIV workplace policy development. The grant had also enabled Malaysian AIDS Council to mobilize 10,000 university students through the Red Ribbon Youth Club all across Malaysia and meaningfully engage them in HIV and AIDS workshops, social work activities, and community events. In 2014, the partnership was extended to its fundraising arm, the Malaysian AIDS Foundation, through a 3-year sponsorship worth 1.5 million on the POW scheme, a medicine assistance scheme for underprivileged Malaysians living with HIV. The POW scheme was under threat of discontinuation due to lack of funding. Yayasan Sime Darby's timely contribution would ensure that a total of 100 beneficiaries would have been reached by 2016 with life-saving second-line antiretroviral medicines, particularly those living in remote areas of East Coast Malaysia where access to HIV services is limited. The HIV epidemic is a battle that can be won. We have mounting evidence to prove that public health approaches that respect a person's dignity and rights to health, such as the Harm Reduction Program, are effective in controlling the epidemic and improving the health of people living with HIV. But we cannot fight this fight without determination, compassion, leadership, and commitment from all sectors: government, corporate, the media, NGO, and the community. And we certainly would have not made it thus far in our journey without the support of our pal, Yayasan Sime Darby. This video presentation was made possible through Yayasan Sime Darby HIV Leadership and Advocacy Grant for Malaysian AIDS Council.